So this is a screening exam that I created to look at a few key components of impairment within the shoulder function of rock climbers. A few things that we looked at were thoracic mobility, the mobility and control of the scapula, the balance of the rotator cuff, and the mobility and stability of the cervical spine, as well as the length of the bicep, which is more the elbow's influence over the shoulder. So the exam starts in standing with forward elevation of the shoulder in the plane of the scapula, which is not flexion, it's not abduction, it is between the two in the plane of the scapula. You want to ask the participant to raise the arm up until they feel comfortable in range. You can either measure with your eyes and see if they get all the way to vertical, which would be roughly 180 degrees, or you can measure with a goniometer, depending on your setting and if you need to document progress. From there, dropping the arm down into the plane of the scapula again, but with the arm positioned at 90 degrees, we're looking at internal rotation. And we're looking at the ball and socket motion without the scapula starting to elevate and compromise motion that way. So we'll take a measurement with your goniometer there, or eyeball it, however you'd like to do that. And measuring into external rotation as well. Also, again, feeling for the stillness of the scapula as you appreciate the full rotational range of the humerus in the socket. From there, we can do a couple of motion tests that look at the mobility of the thoracic spine coupled with the scapula. So raising the arm up through the full range of the shoulder. Once you appreciate some sort of an end range through gentle overpressure, turning the head to the left. Once they reach end range of the cervical spine, ask them to raise the arm back a little bit further. Engage if they're able to improve their mobility just by turning the head, and then have them lower the arm and turn the head back. So a positive test with that shoulder flexion cervical rotation test is if they rotate and you cannot further extend the shoulder. What that indicates is a limitation in the upper thoracic mobility. From there, we can look at bicep length, and when you're doing this either in your clinic or in your gym, you're going to ask the participant or your subject to back their scapula against a wall. You will manually hold that there as you pronate the elbow and extend the elbow, and you're feeling for the scapula going into an anterior tilt. That's when the short head of the bicep starts to pull on the coracoid process and pulling the scapula into anterior tip. From there, we'll do some muscle tests, looking at serratus anterior and the upper rotators of the scapula. Holding in about 150 degrees of shoulder flexion, you will put your hand around the bottom angle of the scapula. Hold that while you resist shoulder flexion. Don't let me pull, hold. And you're feeling for the scapula to give way into your hand. As soon as the scapula gives way, that gives you a feel for how much force those upper rotators can tolerate. You're not looking at the ability for the shoulder to stay still, it's all about the scapula. Lowering the hand down to 90 degrees and doing the same test, appreciating where they're strong. A lot of climbers are going to be weak up here because of the dominance of the muscles that depress and internally rotate the shoulder girdle, as opposed to the muscles that elevate, upwardly rotate, and externally rotate the shoulder girdle here that we're testing. From there, you go back into the plane of the scapula where you took your range of motion measurement, and you check resisted external rotation, don't let me push, hold. Come down into internal rotation, resist internal rotation, don't let me lift you, press, hold. From there, we can move our exam into a seated position. Go ahead and have a seat. And in this study, I used an app on the iPhone that's just basically a digital compass that's using the accelerometer inside of the iPhone to measure rotational displacement. So to measure the rotational motion of the kind of mid and upper thorax, go ahead and have your subject hold the elbows. You're going to set the settings on the iPhone so you zero the compass out. Place that on the manubrium of the sternum, and you're going to ask your subject to rotate to the left without lifting the sit bones up or side bending into the back, doing some sort of compensation. You record your measure there, going to the right, and record your measure there, coming back to the middle. From there, you can appreciate some things about the cervical spine, looking at the side bending range of motion. You can use a goniometer to measure this. Go ahead and side bend your right ear to your shoulder. And you take your measurement there, coming back, side bend to the other direction, and come back. Then measuring rotation, go ahead and rotate right. The positioning is ideal to be right in front of the subject. Turn to the left, and come back. And then very important for rock climbers, the ability to extend the neck. Go ahead and drop your head back, and then back down to neutral. Appreciating the extension range of motion, the smoothness of the motion as well. From there, you can have them lie down on their back. We're going to look at a series of things here. Go ahead and fold your hands on your belly. This is ideally done actually laying flat on the ground or on a treatment table, like a massage table or a high-low physical therapy treatment table. From here, we're going to look at the pec minor length. We're going to palpate the back corner of the acromion, which is basically just the bony point at the back of the shoulder. And you'll measure that down from that point to the surface of the table that they're lying on, or the ground. Take your measurement there. That'll give you an idea of their pec minor length. Also in supine, we can appreciate the ability of the cervical spine to recruit the deep cervical flexors without overflowing into the superficial muscles of the neck. Using a blood pressure cuff, or in this case the stabilizer made by the Chattanooga company. This is a validated test for deep cervical flexor control and often can be an indicator of stiffness in the suboccipital muscles. What you do is you place your pressure gauge under the neck of your subject. You want to support the base of the head so that the chin and forehead are level. In this case, we don't need any kind of support. Pump your blood pressure cuff or your stabilizer gauge up to 20. And then you ask the participant to gently nod the chin down towards the Adam's apple. And then relax. And I add an additional cue of nodding the chin and sliding the base of the skull up the table. From there, you appreciate the displacement of the needle. Relax your neck. And then you're going to palpate the muscle activity on the front of the neck, feeling for the scalenes. Now the scalene muscles are going to be right behind that diagonal sternocleidomastoid, so you just dip down a little bit lower than that. Palpate those muscles and ask them again to nod the chin down towards the Adam's apple. When you feel the scalenes come on, note where the needle is on the gauge, and that gives you a score out of 5. Each displacement of the needle for 2 additional millimeters of mercury is 1 point. So if they get all the way up to 30 millimeters of mercury without activating the scalenes, then they've got a 5 out of 5 score. If they get to 28, that's a 4 out of 5, and so on and so on. From there, you can also assess the extensibility of the latissimus by palpating the epicondyles of the humerus. You'll hold those points into external rotation and you will forward flex the shoulder until you feel those points start to externally rotate. When you feel that external rotation start to occur, that's the latissimus and the teres starting to rotate the humerus, and that's where you want to take your measurement of lat length. And that's the screening exam. You can run your patients through and get a good feel for how their thorax is moving, how they're controlling their cuff, how well balanced their cuff is, and get a feel for what you want to start addressing in their exercise program to make their climbing performance optimal.